Today I will present available ICE technologies and standardized views. I have nothing to declare. So, intracardiac echocardiography is an advanced imaging modality and provides high-resolution real-time visualization of detailed cardiac structures, and it is really important in many EP procedures, and it is really useful for guiding transeptal puncture, for assessment of catheter tissue contact and lesion during ablation. It is useful in reduction of procedural radiation and in assessment of left atrial appendage, as well as in prevention and early recognition of potential complications such as pericardial effusion and cardiac tamponade. So two main ICE 2D technologies are available nowadays. First, the radial or rotational ICE catheter, which is a mechanical non-steerable catheter and provides a 360-degree image perpendicular to the long axis of the catheter, and it offers excellent near-field resolution up to 5 centimeters. However, the depth of tissue penetration is one of its limitations. So nowadays, linear phased array ICE catheters are preferred, and this catheter uses a 64-element transducer and produces a 90-degree image perpendicular to the tip of the catheter, a single image. And the main advantages compared to radial catheters are greater depth of tissue penetration and far-field imaging up to 15 centimeters. Color flow Doppler capability and deflection of the catheter. The catheter can be deflected in different directions. Some linear phased array ICE catheters incorporate magnetic sensors in their tip, so the ICE images can be integrated with electroanatomical mapping systems. And finally, there are the most recent and advanced ICE systems, volumetric ICE systems, that provides high-quality images and are particularly useful in complex cardiac procedures. So let's see the four basic ways to manipulate a catheter, a phased array ICE catheter. This is the AcuNav, and we can advance or retract, so change the imaging level. We can rotate the tip clockwise or anti-clockwise. By rotating the handle, as you can see in this video. We can deflect the catheter in 4 directions with using 2 knobs, anterior, posterior, and right and left. And there is a locking ring. We can lock the catheter in specific deflect position. So let's see the basic views from the right atrium first, and the most important view is the home view. It is the default starting view for many ICE-guided procedures. Once the catheter is advanced typically from the femoral vein and the inferior vena cava to the mid-right atrium, the probe is positioned anteriorly in front of the tricuspid valve and in neutral position. So the home view shows the right atrium, the tricuspid valve, the right ventricle, the right ventricular outflow tract, and the aortic root with non-coronary cusp closest to the transducer and lies adjacent to the interatrial septum and the parachysian region. And the most anterior cusp is the right coronary cusp, is positioned, displayed in the septal area, posterior to the septal area of the right ventricular outflow tract. A slight clockwise rotation of the catheter shows the left ventricle in long axis view and the left ventricular outflow tract, and always on the right side the aortic root, and always the non-coronary cusp closest to the transducer, and now we can see the left coronary cusp instead of the right coronary cusp. More clockwise rotation shows the interatrial septum between the right atrium, the left atrium, shows the mitral valve and the left atrial appendage, which is displayed anteriorly, and the coronary sinus posteriorly. More clockwise rotation shows the left atrial and the left atrium and left pulmonary veins. And this view is essential for assessment of left pulmonary vein anatomy to observe whether there are two separate veins or there is the presence of a left common pulmonary vein to guide AF ablation strategy. Additional clockwise rotation reveals left atrium and the posterior wall of the left atrium, as well as the esophagus and the descending aorta. Further clockwise rotation brings the right pulmonary veins into view with a slight advancement of the catheter into the high right atrium. And first, we can see the right inferior pulmonary vein with additional, in long axis view, with an additional leftward deflection. And with more clockwise rotation, we can see the right superior pulmonary vein. So real-time visualization and assessment of the interatrial septum is important for many EP procedures requiring transseptal puncture. And there are two main views for assessment of the interatrial septum of the fossa ovalis: the long axis view or bicaval view, showing the superior and inferior aspects of the interatrial septum, and the short axis view, which is an optimal view for assessment of the posterior and anterior aspects of the septum. So let's see the basic views from the right ventricle. And view from the right ventricle can be obtained by advancing the ICE catheter from the right atrium into the right ventricle, applying anterior tilt of the catheter, while keeping the tricuspid valve in view, and advance the catheter and then release deflection at the same time to neutral position in order to avoid advancement of the catheter against the inferior wall and the apex of the right ventricle. And from this view, we can see RV structures like anterior papillary muscle and moderator band. Slight clockwise rotation shows the interventricular septum, and we can see the left ventricle in long axis view and the apex of the left ventricle, and additional clockwise rotation shows the posteromedial papillary muscle, and more clockwise rotation shows the anterolateral papillary muscle and the lateral wall of the left ventricle, and this view is crucial for assessing and precise anatomy and number of heads during a catheter ablation. An important view is the short axis view and outflow track view. When with more clockwise rotation, the catheter is positioned in the RVOT, in the septal area of the RVOT, and we can see the three cusps: right coronary cusp, non-coronary cusp, left coronary cusp, the left atrial appendage, the left superior pulmonary vein, and the ridge. And with slight advancement, we can see the pulmonary artery and the pulmonary cusps. And this views is important to guide ablation of ventricular arrhythmias originating from these structures. It is important to prevent collateral injury to structures such as coronary arteries, and it is an important view for assessment of the left atrial appendage here. And for ablation, it is important for ablation for assessment of the position of the catheter to the ridge or the posterior aspect of the left superior pulmonary vein during pulmonary vein isolation. To summarize, ICE has progressed from early rotational probes to advanced phased array systems, becoming a key intraprocedural imaging modality in modern electrophysiology. Familiarity with basic ICE views enables a reliable real-time imaging that enhances safety and efficacy in many EP procedures. Thank you so much.